Welcome to the nursing program. Each of the 4 nursing courses requires the purchase of the syllabus from the bookstore. This is an instructional overview of how to use the nursing syllabus. For demonstration purposes, we will use the Nursing 1 syllabus. This is a demonstration syllabus. Dates and page numbers may differ according to academic semester. In the front section, there is a comprehensive book list of required texts for nursing. Please page forward to Course Overview and Outcomes pages. The overview and outcomes are specific to each course and reflect the content to be taught during the semester. Turning the page, you will find the student semester layout grid. Column 1 contains information for GAS, General Assembly Session, which is held on Mondays from 2 to 4 p.m. The second column is the content for the first lab of the week. When a student has scheduled their clinical laboratory experience will dictate when this content needs to be prepared for. For example, a student with lab on Monday at 7 a.m. will need to have prepared the assignments and material in the first lab column for Monday at 7 a.m. The third column is the second GAS of the week, which will occur on Wednesday from 2 to 4 p.m. The fourth column is the second lab of the week. For example, a student with a Wednesday-Friday lab would prepare this material for Friday. The fifth column is the Small Assembly Session, or SAS. Each student attends 1 session per week. SASs are held every day of the week and online. Check your schedule to know when to be prepared for SAS. The final column lists written assignments, which will be discussed in lab group. Also found on the semester layout are quiz and exam dates for the entire semester. You will note that the first quiz of the semester is on Wednesday. The second quiz is on a Monday. The final page of the front section describes the grading process. Quizzes are worth 10 points. Exams 1, 2, and 3 are worth 110 points, and Exam 4 is worth 120 points. Please read over the information. If you have any questions, please ask the faculty. The next section is labeled Nursing Simulation Lab, NSL, and will be reviewed by your lab instructor. Please proceed to the next section, labeled GAS. The first page is a schedule of classes, and also lists the dates of quizzes and exams. Once again, you will find the course outcomes, and on the following page, Unit 1 objectives. These objectives are then further broken down in each GAS lecture. As you look at the first GAS lecture, there are multiple instructional objectives that will be covered in lecture. There is a pre-GAS assignment of required activities to be done prior to class. These will include any readings from textbooks, assigned videos or DVDs, vocabulary words, and completion of other written work. The approach indicates how the objectives will be addressed. The post-GAS assignment should be completed after GAS and prior to the quiz or exam that is scheduled the following week. All assignments contain testable material. If you turn the page, you may find additional information and/or readings. For the first GAS, for example, there is information on the Nurse Practice Act, critical thinking, and the profession. Occasionally, outlines will be included in the syllabus, as seen on the following pages. If not included, they will be distributed in class. Please proceed to the next section labeled SAS. The first 2 pages will be reviewed in orientation. They are followed by the objectives for the first SAS. The format is similar to GAS, with objectives, pre-SAS assignments, approach, and sometimes post-SAS assignments. It is expected that you will do the readings assigned here prior to attending your scheduled SAS. The approach for SAS may be different than GAS, as there may be more student-instructor interaction and group activities. Please note that there may be additional readings, vocabulary lists, etc. following the SAS objectives. Please remember any information included in the syllabus is testable material. Please go forward to the Clinical Lab section of the syllabus. This section outlines the expectations for clinical lab experience and will be covered in more depth during lab orientation. Please note that the format is similar to GAS and SAS, with objectives, pre-lab assignment, and, instead of approach, a designated learning experience. The next section is labeled Specialty Objectives and will be covered by your lab instructor at the appropriate time. Progressing forward, the next section is the Appendix. This is a compilation of commonly used lab values, abbreviations, and conversions for quick reference. The remaining sections, labeled Clinical Progress Summary Report and Lab Journals, will be covered by your lab instructor. The last portion of the syllabus is the Nursing Education Student Handbook, or NESH. The policies contained in this handbook apply to all 4 semesters of the nursing program. It is the student's responsibility to become familiar with and understand the policies. In conclusion, students find many ways to organize the syllabus to meet their learning needs. Some students separate GAS, SAS, and Lab into separate folders, and others put the entire syllabus into a 3-ring binder. It is important to remember that you must bring your syllabus to each of the 3 class sections, GAS, SAS, and Lab. Good luck as you begin your nursing career. The faculty is here to help you on your journey to becoming an RN.